This is going to have a trigger warning because we're talking about shaken baby syndrome. And I'm going to show you something that might not be so pleasant. So just a warning. What do colic and shaken baby syndrome have in common? Colic is typically about 3 hours a day, anywhere from 10 p.m. to midnight, lasts for about 3 hours, and that's what it is by the book. However, there are some extreme cases that last much longer than that. And there are people who don't know any better. And what happens is when that baby is crying and screaming, they will shake the living daylights out of that baby to stop it. And that's what I had one dad do. He just shook the baby enough that that little boy was brain damaged for the rest of his life. I managed to see him when he was 2 years old, and he would just sit in his high chair, would barely move, and he was no longer what he could have been or what he was. Why is that? That is because when you're shaking the baby back and forth, what happens is as the baby's body and head is moving forward, you're creating damage here. You're overstretching and going backwards, hyperextending. But what's happening to the brain? As that head moves forward, the brain is actually moving backwards. As the head moves backwards, the brain is moving forward. So you're just having this violent motion of the brain that's loose inside the skull. And a lot of people don't realize it. And they shake and they cause permanent brain damage. So how is this possible? A lot of people say that could never happen to me, that could never happen to anybody I know. People know. People really don't know, and that's why I'm creating this video. I can tell you both my kids had extreme cases of colic. My son would cry for like 23 hours a day. And the only thing that consoled him somewhat was breastfeeding. So this was a horrible time in my life. And of course, my daughter would have it too, because what else happens with a doctor? You have exactly what it is you treat, and you have the worst case of it. She had it for about 18 hours a day. And I can tell you that I understood in those moments because you feel like you're losing your God-given mind. You can't get it out of your head. And you think, oh my gosh, this is why people do it. They just want to do anything. They're desperate. They don't ask for help. They don't know to put down the baby and walk away. Because sometimes when a baby is crying nonstop and you've changed it and you've loved it and you've fed it, and you've done everything you can do for your baby, you just have to put that baby down and walk away. Nothing's going to happen to that baby. That baby's just going to get redder. Baby could throw up. You're going to hear the baby stopping crying. You're going to come back. You're going to clean it up. It's really that simple. It's just mentally the most taxing thing to do. So it's important to know that the stages of colic, they typically begin around 3 weeks of age, and they are typically gone by about 3 months old. By the time they're 3 months old. However, the peak is somewhere between 6 and 8 weeks of age. So you've got to hold on, ask for help, know when to walk away. I hope you found this helpful. If you did and you'd like some more, please click the link below for my newsletter and like, follow, and share the channel. And until the next time, please be kind to yourself, and bye-bye.